Okay, hi. So my name is David Sungho Park. I'm an assistant professor here at KDI School. And yes, I'm a development economist. So that means I do research on development topics. So I often have a hard time defining myself as a researcher because I'm interested in so many topics. And so someone would ask me, okay, I get that you're a development economist, but okay, is there any subfield that you're interested in, like labor, health, like something? And then usually my answer is, yeah, all of them. So I do have that problem. But anyway, one common thing among all my work is that I use this tool called randomized control trial. So it's not really something really brilliant and new, but that's something that really changed the way that how I looked at things. So that's going to be something what I'm going to share it to you, that how I got drawn into RCT, randomized control trial, as a tool as a researcher, and also that how that changed me, how to look at things differently. I'll start with a very big question, how do we know what we know is true? So I also admitted it's a too broad question, so let me narrow it down a little bit. So since we're at a public policy school, let's talk about public policies, or policies. So there must be many opinions about policies, but what I think is that policies is about fixing problems. So we as a society, we identify a problem, we find potential solutions, and we try to design that into a policy and implement those. So as a result, there are already many policies in place in around the world, either by the government or the NGOs or by the private sector. These policies are a reflection of what we think that a given social problem, how to solve that, and it's a reflection of how we think a specific social problem should be solved. So the question here, related to the bigger question I gave you at the very beginning, is how do we know whether we're correct? How do we know whether these existing policies are working properly? How do we know whether there are any different policies that could work even better? So I'll give you one example that I'm interested in, tackling global poverty. So global poverty, or eradication of global poverty, or achieving universal economic development, has been one of the most difficult and also the greatest challenges of humanity, and also one topic that I'm really excited about as a researcher. So this extreme poverty, over the past couple decades, we did quite well as a world in terms of reduction of the number of people living in extreme poverty. But still, now today, if you look at the numbers, it's the scale of this global poverty, this extreme poverty is really not that it doesn't really look that good still. So now around 600 million people around the world are living on less than about $2 a day, and that's about 10% of the global population. And also, if you look into these distribution across regions, you can see some particular region, namely Sub-Saharan Africa, actually it's not really solved even over the past couple decades. So this is still a serious problem that unsolved. To us as a humanity. So to address this problem, over the past several decades, many NGOs, many governments, many these charity organizations, they have implemented all these different policies and programs to target this. So some of the earlier generation of these such interventions have been focused on these human capital investments, health and education. So these could be in the form of building more schools, building more hospitals, or it could be providing training to teachers or doctors and nurses, or it could also be providing these school material, textbooks, or some vaccination to kids. So, and also there are another set of interventions or policies that target at physical capital, which could be used towards business investment for the target population. So, for example, because majority of the poor population in developing countries, they are subsistence farmers, there has been many interventions that targeted at just directly providing agricultural inputs like chemical fertilizer. And you might have heard of microfinance or microcredit, and those type of interventions also kind of fall into this space, where a small loan is given to the small business owner, which also happens to be quite a prevalent form of employment in developing countries. And there's also some set of interventions that gave out in-kind transfers, like food vouchers, and of course the intention of these were to directly address this issues like food security of the poor population. And a little bit more recently suggested and tested option is just giving people cash. So if you first hear about this, just providing cash with no conditions, that might sound a little bit too radical, and maybe just too easy, and a little bit more problematic. So one could argue that, okay, this free money, when you give it to them, people might get too dependent on it, and then when the transfers end, I mean, it will end sometime, they would not be able to manage their welfare by themselves. And another concern is that, okay, when you just give people money, free money, people might become lazy. They become like work less. Okay, because again, like one thing that you learn in an economics classroom is that, okay, you need to work because you need to eat. And also there's a trade-off between how many hours you can put into labor and leisure. And one implication of that simplified model is that, okay, when there's some added income, you're supposed to work less, or you're kind of predicted to work less. So that was one concern. And also, again, maybe this is a little bit more obvious, but like, this is free money. So, okay, when you give people free money, like either poor people or non-poor people might just waste it. People might just like spend it on some useless things, like some temptation goods like alcohol and gambling. So these are all the concerns, and even me as a grad student, when I first learned about this idea of giving people cash with no conditions attached, I was a bit skeptical too. I mean, it just sounds not right, just giving people cash with like no conditions, it sounds too easy. However, I also quickly learned that this is something testable. You can just give people cash, I mean, as an intervention, like do it in a proper way, and then you just wait and see what happens. And luckily enough, I did had the opportunity to be part of a large-scale evaluation of a cash transfer program in Liberia and Malawi. And that was like one project that I spent most of my time as a grad student. And that was also like when I was kind of drawn into this tool of like randomized control trials and how using that could really like kind of make me rethink what I think I know. So, okay, like RCT, like you might have heard of an RCT, or those who have not. RCT is really, the idea is really quite simple and straightforward. Okay, RCT is just like one way of testing a solution to a social problem in the same way that you would test a new drug or like a new vaccination. So, for example, all the like COVID vaccinations, all the trials, they were kind of happen in some version of this way. So, in an RCT, what you first do is that you recruit a study sample, and then you randomly divide into two groups, or maybe several groups, depending on how many treatment you have. But anyway, you divide into two groups, and like in the treatment group, you give the intervention or the policy that you're interested in. So in my case, it was like cash transfers, and you give nothing to the control group. So you wait for a while after, maybe several months, maybe several years, depending on the study design, and then you do like measurement on these both groups separately. So these are like surveys. So like in my case, what you do is that we have all this kind of set of questions of, okay, how much money you spent on food in the past week, like whether or not your kids are at school, and all these kind of sorts of questions. And then later you result those outcomes between those two groups, and because of the random assignment happened at the beginning of the trial, any difference between these two groups that would happen after the trial started, that could be attributed to the effect of the intervention, which was only given to the treatment group. So that's like the core idea of like a randomized control trial. And this is how an RCT looks like in a textbook. You might have seen it before. And this is how it looks like in the real world. So these are obviously some pictures that I took myself when I was in the field. So as someone who's doing research in doing RCTs in the field in Africa, I mean, you have to be there. So as a grad student, I did spend a lot of time in Africa. So these are some like random pictures that I took, and I enjoyed putting them together. But anyway, just to tell you a little bit of my story, like how I got onto this field, is that as someone who started my Ph.D. program at the very beginning, I was actually like not sure what to do. So yeah, I mean, I liked economics. I mean, like I kind of like wanted to do something using that, but I really didn't know what to study on, like what topic that I would study on. So after my first year, like one professor at our school, like he sent around the email to all the first year students asking whether there would be anyone who would be interested in spending the summer in Malawi, like working on a project, like RCT project on mobile money. So back then, I'd never been to Africa. I mean, to be honest, I wasn't even sure I'm interested in development issues. So, but still I volunteered, mostly because I just really didn't have any alternate option for that summer. So anyway, that summer ended up, I mean, I really enjoyed a lot. I experienced a lot, and like I really learned a lot. But again, like mostly, I enjoyed it a lot. So like RCT, like in the idea on the textbook, it's really simple and straightforward. But like actually like conducting it like takes a lot of time and effort. And I was actually just enjoying just like paying all that effort on the ground. So since then, I mean, that was my first visit to Africa, but not my last visit. And I really got into this field of development. And especially, I really got like drawn into this tool of using randomized control trials as one way to like test these like social solutions to like a social problem. So back to the textbook. In addition to like our own RCT evaluation of cash transfers in Liberia and Malawi, over the past several years, there has been this accumulation of RCT studies on cash. And so far, the evidence suggests that the cash works pretty well. Okay, so simply giving cash to poor households, it looks like it causes improvement in many aspects, like nutrition, like these education outcomes, like health outcomes, even like intimate-partner violence. And more interestingly, there's actually no study so far that shows the problems that we discussed in one of the previous slides. For example, like making people, like cash would make people lazy. Actually, in some studies, they find that giving cash make people work more. And that's because this extra money, this added income to the households, that opens up more space, which allows them to be less stressed and more focused on their main occupation, also increase their labor productivity overall. And there are also some couple of studies that compared cash transfer programs directly with some conventional poverty alleviation programs, like some kind of programs that were targeted at health and hygiene facilities. And they find that cash works even better than these conventional programs in terms of some outcomes. So all of this was quite surprising to me as well. Again, before, more in my earlier years in my grad student, when I first hear about this cash transfers, I was really skeptical about it. But after running an RCT myself, being part of the team of running that, and also seeing this evidence, this really changed my way of thinking about this. And also, this is also kind of start of there is a way to re-look at things that I thought that I knew. So in a similar vein, actually there are some RCTs that show failure of conventional programs. So one of the earliest RCTs in this field was about giving textbooks to kids at school. And in a context where you can imagine where there are not enough textbooks, and some students, the kids need to share one textbook with their classmates. You can easily think that such program would have some significant effect on their school performance. However, the studies find that the textbook had no effect at all, and of course that was a big surprise not only to the researchers but also to the policymakers and the implementers of such programs. Because this evidence was directly against what they thought they knew. And so this example, and maybe some examples that I gave you, this all kind of tells us that there is still quite so much we don't know, or more precisely, there must be a lot that we think we know, but we still don't. So I kind of shared my experience, how I found RCT as one powerful tool to let me radically rethink what I do. Rethink what I know. And obviously, the more important question here, the more important lesson here is that we kind of keep doing that. So I would kind of conclude this as that I also hope that you find your own tool that would help you and allow you to rethink what you think you know. Okay, thank you.